Okay, well, good afternoon, everyone. Welcome to session A of the Wednesday, April 27th, day 3 of your Sound Careers in Healthcare event. And the title of this session is Improving Healthcare Access Among BIPOC Communities. And so we're really excited to have two speakers who really live and breathe this every day and do this in their place of work, but have also made this probably their life work. And so we're excited to welcome both Silvia Kennedy as well as Giselle-Zapata Garcia. And I'm going to let them introduce themselves, but I'll just start off by saying that Silvia Kennedy is a cultural navigator supervisor at Swedish Medical System, and Giselle-Zapata Garcia is a navigator enrollment manager at Seattle King County Public Health. So one thing to note right away, these are two very different systems, right? Really big hospital system that is Swedish compared to Seattle King County Public Health, which is a community clinic setting. So hopefully those of you joining in who are students are starting to pick up already during this week that there are lots of different healthcare settings, right? And lots of different types of professions and occupations. And so I think this session with Silvia and Giselle are great examples of some unique occupations, some very important occupations, and ones that really demonstrate that there are different healthcare settings because there are different patients, right? And different needs, and that's very important to address. So here's what I'd like to do. First of all, welcome everyone. A reminder, and maybe I should actually activate the questions, a reminder to our students that you should most certainly ask your questions. And I think, if I'm right, I've lost track of all the prizes and all the awards that happen this week. But I think the more questions you ask, the more likely it is that you win something, right? So keep those questions coming in. I was part of it yesterday and you all had some awesome questions. So pop them up now if you want, but we are going to go ahead and get started. And Silvia, I'd love to start with you. And before we get sort of into kind of how you got to where you are, I would love for you to actually tell us, what does a cultural navigator supervisor at Swedish Medical System actually do? What does your day-to-day look like? What are some of the achievements that you need to be able to say, you know, your work has done? Give us a flavor of that.
Thank you. Thank you so much for having me here. I'm very excited for this opportunity. Once, not a long time ago, I was in college and also I was in high school too. So that was not a long time ago, but very excited for this opportunity to be able to share about what I do, but also something that became part of my life and my family's life too. And it's something that I have enjoyed really doing. Cultural navigator is has different names. I believe that Swedish decided to call it cultural navigator, but in some other hospital or clinic settings, they call this position community health workers, promotoras de salud, community allies, and others. So what a cultural navigator does is really helps connect the community through different resources to ensure that they will have opportunities to access healthcare services and to continue their treatment or any other process to ensure that they will have that they will be able to survive. So, but it's beyond that. Also, cultural navigator needs to create a huge network to ensure that they can help the patient go through that process too, because it's impossible for one person to be able to resolve all the problems. So we are in the community, we are in the hospitals, and we are also in the clinics. We have for our team that decided to call cultural navigators because we represent different cultures and also represent different communities. But it doesn't mean that we are limited to just serve the community that we represent. So that is kind of like a brief. This is, I believe, one of the programs that is not too new in the system, but it's very new for Swedish. And now we're starting seeing more hospitals and other health institutions investing more on programs like cultural navigators or commercial workers or promoters, because it's a program that works and also saves a lot of funding and cut expenses as well in the health system and for the patients too. So that's kind of the overall description, I will say, of how they define these positions. I feel, and my team feels, that we do everything.
That's great, Sylvia. Thank you. And just a couple things I heard, and then Giselle, I'd love for you to tell us the same. You know, what does it mean to be a navigator enrollment manager in the public health setting? But Sylvia, a couple things I heard that I think are really important. First of all, thank you for defining a little bit more what the cultural navigator means, right? There are so many, again, occupations and jobs in healthcare settings, but this one's quite unique, right? It's the combination, if I heard you right, of how do you help a patient and probably their family navigate the resources that they might need, whether that's in their community, in their healthcare setting, but all toward making sure they can stay on their treatment plan, right? This is all about patient health outcomes, isn't it? But it's critically important that that cultural navigator can really speak the language, understand their healthcare beliefs, perhaps, really meet them where they're at. So much of what we're hearing this week, but I think more and more, which is important, is how do we actually make sure that care providers, whoever they might be, a navigator or a doctor, sort of understands who their patients are, right? And does not bring in the biases and the assumptions that could really prevent them from staying healthy or staying on their treatment plans. So I like how you described the navigator position as kind of that cross section of the cultural navigation and the resource navigation that comes together. So thank you for that. And then Giselle, I would love to hear from the public health setting. What is your role? How is it similar to what Sylvia described at Swedish? Tell us a little bit about the day-to-day of the occupation that you have, and also maybe the team members that you help supervise or work with.
Okay. Thank you again for having us. It's such an honor to be here with you all. And thank you for joining us in this particular session today. So the position that I have as Navigator Enrollment Manager and Latinx Coordinator has a couple of different responsibilities. So the Navigator Enrollment Manager side of the work is really overseeing the team that it is based out of our different public health center sites as navigators. And navigators in the way in which you have a patient, or what we call a client, that needs assistance to get onto any of a variety of different social services programs. So it could be Medicaid at Washington Apple Health. It could be any of the programs through SCIH, like cash assistance, basic food, childcare assistance, Medicare assistance premiums. There's a whole long list of programs that SCIH has under them. We also assist with getting an OrcaLift card, annual subsidized passes, as well as making sure that the client or patient is able to be walked through that whole process. So it's that, navigating the healthcare system component. So it really could entail so much more. So it's interesting because a person can walk into the office of the navigator thinking they're just needing help with, say, getting onto Medicaid for their newborn baby. But then it turns out that they're eligible for all these other services and programs. And so our navigator is going to explain what those are, talk about eligibility, and then assist them through the whole process of the application, as well as any follow-up, and ensure that if there's any advocacy that needs to be provided, that is also done. There's a lot of the navigators that are spend, an hour or more with each client, depending on what their needs are, helping them make phone calls, sometimes interpreting for them in as part of the steps of getting them the program or the services that they're needing. So it's very holistic in that way. But the team that I'm overseeing, they are definitely housed at particular public health clinics. So they're not out in the community per se, although we do have lots of community events in our department that we do. And so sometimes they will join us at community events on in the weekday evenings or on the weekends. But for the most part, that's why it's the title is Navigator Enrollment Manager of the at the public health centers, is because that's where their main base is. But outside of that, they do get that opportunity, and that's the piece where when I heard you say you go to where the community, meet them where they're at. You know, the public health dental clinics requires you to come to our clinic. But when we're doing events, because we're able to in the access and outreach team as a whole, then we're going out to the community and offering these same services and more, which we didn't talk as much about, but we do things like health fairs, mobile mammogram events, dental events and stuff like that to bring the services to the community. And so I think that that kind of gives you a big picture, because I know our time is probably limited, but that is kind of the scope of it.
That's great. Thanks, Giselle. And there's two questions that have popped up, and I think they're definitely worth touching on. First of all, I think both of you have touched on one of them, and that was, does a cultural navigator provide resources, I think, to the patient involved? And I think you've both described, I think, that role. Giselle, you in particular, really making sure, and the word enrollment in your title, I think, helps with this, but it's really making sure the patient is enrolled in all of the programs that they should be in order to receive the right package of benefits along the way, right? Clearly, though, and this relates to the other question, and keep those questions coming in, students, these are really good. The other question is what's the college major to become this? And here's the thing, right? You've described, I think, sort of like this hybrid combination, this amazing person who has social work, like a social worker, like I hear that, you're navigating, you have to know a lot about a lot of different public programs out there, right? So it's probably not only is this person enrolled in the right health insurance, Medicaid, Medicare, or other, does this person have what their baby needs, things like WIC, right? Or, there's so many acronyms out there, and students, if you don't know, you should know there's tons of public programs, for food and for transportation and for health insurance and for, mental health supports and probably a whole bunch of others. And so this role very obviously requires a lot of knowledge. Now, is there a degree, a program that just sets you right up and gets you into this position? Or tell us a little bit about, first of all, how you got here, right? But then for your team and your navigators, what are you looking for? What credentials, what degree, what experience?
If I can start with answering the question that came from a participant, the college major, because my degree is actually in social work. And so, yes, absolutely, that would be the ideal, but it's not the only one. And what I wanted to share was the what we now call healthcare navigators within the public health system used to actually be called application workers, and application workers were not required to have a college degree. And so what has happened throughout the last couple decades is that it has evolved into a position that really focuses on how to navigate the healthcare system and ensure that our clients are best served and their needs are met. So to the point of what you could have, I mean, you could potentially start in a position like this at the ground level with no degree. But that's going to depend on the company, the organization, and what responsibilities are expected out of that position. Kind of like how I explained that originally a couple decades back, it was called application worker. There wasn't as much expectation around navigating the healthcare system. It was just really exclusively, here's the application, help them fill it out, and that's it. We have over time added the components that really support the community in making sure that they're able to access the services that they're eligible for, and that really is explained by using that navigating the healthcare system kind of framework. So, currently, the team that I oversee, we've got a variety of folks, and we've got folks that have no college degree. We have folks that have master's degrees, but it will actually benefit you to have a degree because you'll be able to come in at maybe a higher pay, for example. And so I think that is one thing to kind of keep in mind. But there's definitely a lot of different degrees that you can have and still be able to do this work, because what it comes down to is, yes, the degree is helpful, but you have to have the passion for this work. I mean, that's just you're gonna know the difference when it doesn't feel like it's a job that you go to. So I know Silvia might want to add on to some of that college major stuff.
I agree with you, Giselle. I think what we do as I can speak about what we are doing at Swedish, but also we have seen among other partners and organizations and other health systems that is happening. I agree with Giselle. I believe that it's different degrees that can help you get the experience that you need for these jobs. For example, we have in our team, everybody has a degree, and most of them has a degree in public health. My degree is as an industrial designer that has no relationship at all with healthcare, but my career help develop programs that are sustainable and processes. So I will say that experience really helped me or position myself as a supervisor, manager, or director inside of my organization. As part of my role is really to develop the programs and the processes for this specific program. What is very important for these positions is to have certain type of skills, and I believe that some of those skills is really like have compassion and desire to help others, because I believe those are one of the two more required skills for this type of work, and also communication. Really understand how to communicate with the community and with others. These positions tend to be in a position where you need to communicate with different people to ensure that the patient will be able to navigate all the processes. So you need to communicate through technology. You need to communicate verbally, but also be able to communicate and be able to write well too. So that's why I always encourage young people to really think about education as a whole, not to give up. We know that it's not too affordable sometimes, but it's different programs that can help you get there. But I think that one of the skills of what we look at it when we're interviewing a potential candidate, first of all, is their involvement in the community, how involved they're in the community, about their communication skills, and also the passion that they have serving others. Those have a big way in during the interviews, I will say that.
That's great. That's great. Thank you so much. I mean, I think I'm hearing from both of you, and I appreciate, Giselle, how you started off sort of commenting on the evolution of this role, because I think this is also something to be aware of, right? Is that healthcare as an industry is constantly changing, constantly evolving, right? And so how do the unique occupations and professional positions also evolve? And that was one of my questions, actually. So I appreciate that it's a little bit of social work, right? It's sort of the new and improved, like version 2.0 or 3.0 of that application worker, that just filled out applications. It's a little bit of interpreter, right? But now, and especially, right, I would say in the past couple years and during this national racial reckoning that we are going through, I'm curious what else has changed potentially about this role that really moves it into a realm of connecting to the communities, and particularly the cultural communities that traditionally may have been left behind in good healthcare. If you can comment on that. I also know that's where your passion, both of you, your passion, you have mentioned that, that's important, your passion lies. So any comments on that? And then we'll get back to a couple of the other questions.
Lindsay, I apologize that my internet went got bad for a little bit, so I didn't hear everything you said. But I think, was it around with the last during the pandemic, like within the last couple of years, what have we seen related
Yes.
to being able to support the most need? Yeah. Okay.
Yep.
I did have one thing that I wanted to share around that, because I have been in this world, not necessarily always at public health, but always either collaborating with public health or being a part of different efforts and projects. So I have really appreciated that while we've been through a really difficult time these last couple of years, what has changed dramatically is that there's been funding that has been prioritized for vulnerable populations, and that has allowed us to serve our most in need in such a more meaningful way. And so there's still a lot of work to do, but definitely we're going in the right direction. So that's been my kind of experience.
That's
I
great.
don't know, Sylvia. Yeah.
Thank you.
Yes, I believe that it's very similar for the hospital systems and also the clinics on the Swedish. It was like a roller coaster, I would say, at the beginning, where we really needed to react right away. And through the cultural navigators and all of those navigators or promoters or community health workers who are very involved in the community, I believe that that's why we were able to really change the outcomes of what was happening and be able to provide the community with the resources that they needed. And especially the information that was very needed, that was changing very quickly. It was just very amazing to see how through these programs, we were able to really disseminate the information that we needed. It is something that is very beautiful about a navigator or a promoter or commercial worker is that the relationship that they already have in the community allows them to ensure that the things move more quickly. It's kind of like the accelerator to the system that is based on trust, but also based on pretty much is based on trust. I will say that has been very difficult for the health institutions to create that on their own, especially among BIPOC communities. So I think that it's extremely important for them to keep these programs, and they have seen the impact of these programs in the community and patients.
So Sylvia, I think that is a incredible point, and that the way you describe that as the cultural navigator position really being an important position to accelerate the ability to reach out to the community members, to make sure those community members, those individuals get what they need out of the healthcare system, because the trust and the shared belief systems are already there. And that, I think, is you said it, it's a beautiful thing. It's a beautiful way to describe it. I'm going to put this question up because it's been upvoted, and I think it's a terrific one. So can both of you think for a moment and quickly in the few minutes we have left, give us a specific example or episode when cultural navigation helped patients?
Yes, I can give you many samples, and I will start with sharing about we have during the pandemic, we have people who unfortunately they lost their battle against the COVID, or what happened to the COVID. So we had, in this case, we have, and it was very difficult times, I will say, as families couldn't get inside of the hospital at all. So we have an amazing cultural navigator who serves the Middle Eastern community. And among the Muslim community they have a window of time after their loved one passed away. They have 24 hours for them to do the service and to do all their rituals. So unfortunately, because of the internal process, it was very difficult for us to do so. And the providers couldn't understand why they needed to speed the process while the family was the only thing that they were asking. We really want to ensure that we have access to the body right away. So the cultural navigator was involved, was asked to step up and help the family understand the process, but also ensure that the internal policies and the internal process was able to be accelerated to ensure that we could ensure that the family will have their body under that period of time, that window. So, and was just one honest conversation that the cultural navigator had with the administration of the hospital that changed the whole environment. And they decided, like, yes, let's do it. Yeah, let's just ask and maybe mobilize ourselves and ask for all the paperwork that needs to be signed now. So and I believe that most of the little but what the situation that was happening there has something to do as well with language barriers, and the hospital not really understanding what was the rush. So that's when the cultural navigator could help really intervene and assist with language, cultural, and also ensure that they understand that under the policies is some holes that you can kind of like tap into those little holes and mobilize and change a little bit the process to ensure that things could happen. So when we talk about a cultural navigator or navigators or commercial workers or promotores working in the health system, they need to have that knowledge. Well, when they have that knowledge, they become more armed to ensure that they could help accelerate what we mentioned before, accelerate those processes in the community, but also inside of the health system. And at the end, things work really well for everybody. And there was a really good example of how things internally needed to be changed too.
Terrific example, Sylvia. I love how you describe there's sort of this intermediary position of having to navigate the belief system, the language, the needs of the patient or the family in that case, and then also having to navigate, understand, and make some, shifts and changes within the internal policies of the system you're working in, whether that's public health, a community clinic, or a hospital. I have to imagine that's true. So we are right at the end of our time. Giselle, do you have any final thoughts or questions? I'm also, everyone, just putting the survey link for this session in the messaging. So make sure you click on that because I think that also gets you points or something for prizes and awards. So make sure, students, that you're making an effort to fill out our surveys. Giselle, any final comments before we send folks off to their next round?
Thank you, Lindsay, and again, thank you for having us. I would love for our young people to really explore all the different options out there and definitely find what you're passionate about and go in that direction, and be open to opportunities along the way, because this is, I didn't start out saying, oh, this is what I'm going to do when I grow up. I thought I was going to be a psychologist or psychiatrist or lawyer or and being open to these experiences have really led me down a path that I don't feel like I'm clocking in and clocking out, and I love what I do.
Great. Thank you so much, Giselle. Thank you so much, Silvia. And thank you for all of your questions, students and participants. And we are now going to rotate out. So I hope you know where to go and how to navigate. We're navigating to our other sessions, and then we'll probably get some new folks in here. So Silvia and Giselle, thank you again.
Thank you.